our last photograph together and our last holiday together.
4 months after this family holiday, Sean Crawford was dead.
Quite often people will talk about whether someone is a glass half empty or half full person, and the best way I can sum up Sean is by saying he was somebody who was just grateful he had a glass. He was his happiest when everybody else was happy.
He was a 41-year-old man with the diagnosis of paranoid schizophrenia. At an inquest, the coroner ruled that his death resulted from combined toxic effect of alcohol and clozapine, individually, not at fatal levels, acting to suppress his central nervous system. Clozapine is a drug prescribed for schizophrenia when other drugs have failed, and many health professionals describe it as absolutely gold standard for preventing things like hallucinations. But there are increasing concerns about how well patients are being monitored and whether they're truly being informed of the sometimes toxic side effects. A recent analysis by the Times newspaper found an average of more than 400 clozapine-linked deaths per year have been reported to the Medicines and Healthcare Products Regulatory Agency, the MHRA, 8 times more than any other high-risk medicine. Mr. Crawford was under the care of the community team run by Tees Esk and Weir Valley Mental Health Trust. The coroner's findings included this.
None of the Tees Esk and Weir Valley staff dealing with Sean ever warned him or his family of a danger of death associated with alcohol consumption in the context of using clozapine. That this danger was not recognised or predicted is a more than minimal contributor to his death.
Sean was not an alcoholic, but he did like a drink. We were repeatedly told it was a known fact that paranoid schizophrenics will self-medicate with alcohol because it helps them to relax. And that actually the conversations that anyone had with us around that were that it could be dangerous for Sean to stop drinking the alcohol.
The coroner also found
the management of care plans and the recording data as to plasma levels and other health data by the Trust was dangerously inadequate.
Sean went to the community health team physical health check clinic every month. You have to when you're on clozapine. And we thought his physical health was being properly, robustly monitored through that process. In the 2 appointments in the run-up to when he's died, there's been no readings whatsoever recorded.
In a prevention of future deaths ruling, the coroner has now informed the Health Secretary, Victoria Atkins. Mrs. Crawford and her local MP have also asked for a meeting. The Department of Health said these were complex issues and they would be responding in due course. The MHRA told Channel 4 News they are reviewing the data, and once that's in,
we will consider the concerns raised and whether additional risk minimisation measures are needed to raise awareness and reduce the risks further.
The patient leaflets do warn about alcohol use. Mrs. Crawford, though, says they need to be more explicit.
In terms of the alcohol as an immediate measure, I would like it to say, the label that's on there, do not drink because it could kill you, or reference to that possibility of a fatality. So that there's a distinction between the kind of medication where if it has exactly the same label and you drink, you might get a little bit sick, but you won't die.
Tees Esk and Weir Valley Trust said, we have reviewed Sean's care and treatment and are committed to making changes. This includes strengthening our processes for clozapine prescribing, dispensing, supplying and monitoring, and we have made a number of changes to the clozapine guidance. William Northcott, or Wim for short, died in 2021 after taking the drug for years.
William was gold dust. He was a golden human being. He could have added something to this world. But the way the system is set up, he never got that chance. And in fact, the medication that he was given actually killed him in the end.
An interim death certificate describes fatal arrhythmia, most likely due to prescription drug toxicity.
We found out in the autopsy his heart was double the size. He had blood clots. He was immensely overweight. And these are very standard symptoms of clozapine toxicity.
Since then, his sister has been campaigning for a new WIM protocol.
There has to be a wholesale change in how the monitoring is done for clozapine. Alongside of that is and also a look at how we look at schizophrenia and serious mental illness as a society.
And the Royal College of Psychiatrists is now working with Kate to improve information given to patients and medical professionals.
Psychiatrists are well aware of the side effects of clozapine, and actually psychiatrists regularly tell people about the side effects of clozapine. However, the monitoring system, as I said, is limited, and it means that particularly at a time when services are so stretched and a person may not get to see a psychiatrist very often, clearly we need to ensure that everybody across the system is aware of all the different side effects and is able to understand them and therefore convey those side effects, talk about those side effects with patients.
Neither Sean nor William's families dispute the value of clozapine. This is not, they say, a call for it to be withdrawn. It is a demand, though, that better care is taken of the patients who need it.